This slide is showing the arrangement of the different muscles inside the different compartments of the leg and how it is divided into two major compartments by the help of two intermuscular septa. Just look on this section. This is a cut section showing the different compartments of the leg. We have two intermuscular septa in the leg, mainly two intermuscular septa. These are the anterior intermuscular septa, it is mentioned over there, and the posterior intermuscular septa. This is the anterior intermuscular septa, and here we have the posterior intermuscular septa. Two septa, the bones that are present in the leg in that compartment is two bones, tibia and the fibula. So the two septa, the anterior intermuscular septa and the posterior intermuscular septa, they divide the leg into three compartments, that is the anterior, posterior and the lateral compartment. You are done with the anterior compartment and the lateral compartment. Now the posterior compartment, when we talked about the posterior compartment of the leg, it is further subdivided into two other compartments or two other groups, subdivisions of the posterior compartment into the deep and the superficial group. So this is the posterior intermuscular septa. The whole posterior compartment is further subdivided into two groups, superficial and the deep group, by the help of another septa that is called transverse intermuscular septa that is present in the posterior compartment. Just this is the, for example, this whole is the posterior compartment, and the posterior compartment there is another septa that is called the transverse septa. Transverse intermuscular septa or transverse facial septa that is responsible to divide the different group of muscles present in the posterior compartment into the deep and the superficial group. You can easily identify the deep group muscles and the superficial. This is the superficial group. Superficial compartments. Subcompartment, we can say the two subcompartments are there in the posterior compartment, the superficial and the deep. Now these are the muscles of the superficial group. Gastrocnemius, soleus and the plantaris. These are the superficial muscles. This is the soleus. This whole is the superficial group. And here is, you can trace this posterior intermuscular septa. Later on, it further divides and forms the transverse intermuscular septa between the superficial and the deep subcompartment of the posterior compartment of leg. Now the different group of muscles that are present in the superficial group. These are all flexors, plantar flexors at the ankle joint. Now the name of these muscles are gastrocnemius, soleus and the plantaris. Gastrocnemius, soleus and the plantaris. Three muscles, three important muscles, they are present in the superficial group. When we dissect these muscles, and there is a partition between these group of muscles, superficial subcompartment and the deep subcompartment. That partition is simply called transverse intermuscular septa. Now all the muscles that are present in the superficial and the deep group, they are supplied by single artery and nerve, but that artery and nerve is located in the deep compartment, and that artery and nerve is responsible to supply all the entire posterior compartment muscles, but it is located in the deep compartment, not in the superficial subcompartment of the posterior compartment below. So what are the muscles that are present in the superficial subcompartment? Gastrocnemius, plantaris and the soleus. These are the muscles that are present in the superficial group. Now the deep group. The muscles that are present in the deep group Okay, I see. The muscles that are present in the deep group are, I don't know if you need maximize it. Popliteus, flexor hallucis longus, flexor digitorum longus, and the tibialis posterior. We are able to observe these muscles that the superficial group is dissected. These are the popliteus, flexor hallucis longus, flexor digitorum longus, and the tibialis posterior. Now we will discuss individually the origin and insertion of all these muscles that are present in the superficial and the deep group. Okay, superficial group of the posterior compartment. Number first muscle, that is the gastrocnemius. Just before having this, just look at this slide. First two slides and then okay, just leave it. So gastrocnemius, this is a slide showing the gastrocnemius muscle. This is the most superficial muscle having two heads, the medial head and the lateral head. The medial head is a little bit larger as compared to the lateral head. Muscle belly is large, tendon is small. So this origin of this gastrocnemius muscle, from where it originates, origin from the condyles of the femur, medial and the lateral condyle of the femur. Lateral head, from the lateral condyle of the two heads are there. Gastrocnemius is a powerful muscle, powerful plantar flexor, and it consists of two heads. Both heads originates from the condyles of the tibia. Medial side, the one that originates from the medial condyle of the femur, and lateral from the lateral condyle of the femur. Insertion. They both inserted by forming converge downwards. Initially, they are in the form of a muscle. Later on, it narrows down and it forms a common tendon that is called calcaneal tendon, and it is inserted into the posterior surface of the calcaneum. Just have a look at this slide. This is the slide showing the origin of the two heads of the gastrocnemius muscle. That is the most superficial muscle, और उसके भी नीचे फिर soleus होगा, plantaris होगा, और then we have the intermuscular septa, transverse intermuscular septa, and deep down to this we have the deep group of muscles, और उसमें we have the popliteus, tibialis posterior, flexor hallucis longus, flexor digitorum longus. Now the two heads, the medial head from the medial condyle of the femur and the lateral head from the lateral condyle of the femur. They both converge and form a common tendon that is inserted into the calcaneum, and that common tendon is called calcaneal tendon or the ACHILLES tendon. It is a common term for used for the insertion of the gastrocnemius plus one more muscle we will discuss later on, that is called ACHILLES tendon. I'm repeating again, this is another slide showing the origin and insertion of the most superficial group of muscle that is present in the posterior compartment, gastrocnemius. Look at these two heads, the medial head and the lateral. Here is the muscle belly. Later on, it narrows down to form the tendon, and that tendon is inserted on the calcaneum. This is called calcaneal tendon or the ACHILLES tendon. You can see easily. Calcaneal tendon or the ACHILLES tendon. Now the transverse, something regarding the transverse intermuscular septa. Later on, this transverse intermuscular septa that is present between the superficial and the deep group, when it goes down, it reinforces and form a transverse band that is called the flexor retinaculum. Superficial extensor retinaculum you are done for the anterior compartment, and the perineal muscles, peroneus, brevis and longus is also held by a retinacula. For all the muscles that are present in the posterior compartment, there is a continuation of the transverse intermuscular septa when it descends down, and it will form the flexor retinaculum that is attached to the tip of the medial malleolus and the calcaneum. Here starts from the tip of the medial malleolus and calcaneum. So, for example, this is the transverse intermuscular septa. It goes down, and later on it forms further reflection and reinforcement that is attached to the medial malleolus and to the calcaneum to form the flexor retinaculum. I put few slides related to the retinacula as well. Okay, so don't get worried. Gastrocnemius. This is the calf muscle. The calf prominence is because of this on our leg on the posterior surface is because of this gastrocnemius muscle. These are the two heads of the gastrocnemius muscle. You can see in this slide gastrocnemius muscle. These are the two heads. Later on, they converge to form a common tendon, and that tendon is inserted on the calcaneum. This is the calcaneum. Calcaneum on the posterior surface of the calcaneum. This hole is the anterior surface. Posterior surface of the calcaneum. There is tuberosity, calcaneal tuberosity. It is inserted. Now the bones osteology of the foot. Bones of the foot. These are just learn the name at that point. Tomorrow you will do the osteology of the foot. The bones of the foot, these are 7 in number. They are arranged into rows, proximal and the distal row. And the name of the bones are calcaneum, talus, cuboid, cuneiform, and the navicular. I'm repeating again: calcaneum, talus, cuboid, cuneiform, and the navicular. So that Achilles tendon is inserted into the calcaneum bone. Calcaneum bone. Okay. Few slides for the bones of the foot as well. This is a slide. This is a slide showing the Achilles tendon again. The beautiful slide showing the Achilles, the most superficial muscle that is present in the superficial group, the gastrocnemius. These are the two heads. And just beneath the gastrocnemius, we have the soleus, and later on we have the plantaris. Then the flexor hallucis, longus, flexor, digitorum, and the popliteus or plantaris. They are close to the bones of the leg, tibia and fibula. The larger group, the superficial group is the larger group as compared to the small deep group. The superficial group of the posterior compartment, therefore it is least confined. The deep group is small of the posterior compartment and is quite just like the anterior compartment of the leg. It consists of 2 bones and the interosseous membrane, and the deep group. I'm talking about the deep group, and it is quietly confined. So it lodges the important nerve and the vessel also. And so the compartmental syndrome can occur at this area, the deep group of the deep subcompartment of the posterior compartment of the leg. So this is the Achilles tendon that is inserted on the posterior surface of the calcaneum. This is the calcaneum bone. Okay. Now the bones of foot. For the bones of the foot, just have a look at the medial view of the bones of the foot. Calcaneum, talus. We have the navicular and cuneiform navicular. These are the cuneiform, cuboids, and later on the metatarsals. These are the bones of the foot. So it is inserted in the posterior surface of the calcaneum, and here on the inferior surface we have the calcaneal tuberosity that will form the heel. This area it is inserted the Achilles tendon on the posterior surface of the calcaneum for the insertion of the gastrocnemius muscle, which is the most superficial group of the muscle. Now the second important muscle, or these are all plantar flexors of the subcompartment, the superficial subcompartment. Just learn posterior compartment. The whole posterior compartment is divided into superficial subcompartment and the deep subcompartment. So the soleus is second important muscle, the soleus. It originates from the posterior aspect of the head of the fibula. Superior part of the posterior surface of the fibula, soleal line, and the middle third of the medial border of the tibia. It forms as there is a tendinous arch. There are different points for the origin of the soleus muscle. Number one, posterior aspect of the head of the fibula. Number two, superior part of the posterior surface of the fibula. Number third point of origin, the middle third of the medial border of the fibula, tibia. So from the two origins, the tibia and fibula, it forms an inverted U-shaped insertion, the soleus muscle. Here you can pick this soleus muscle by the diagrams. Soleus. This is the soleus muscle. Origin from the posterior aspect of the fibula as well, from the medial surface of the fibula and the posterior surface of the fibula as well. This is the soleus muscle. And you are able to identify this soleus muscle, then the gastrocnemius muscle is removed. Soleus is flat, not fusiform in shape like the gastrocnemius muscle. Gastrocnemius muscle having a fusiform appearance. Soleus is flat as compared to the gastrocnemius muscle. Okay, and this soleus muscle is also inserted into the calcaneum. So the Achilles tendon is common tendon for the calcaneum, and for that is also called Achilles tendon. Calcaneal tendon is common tendon for the gastrocnemius and soleus, and they together form three-headed, that is called triceps suri. Three heads of it. How the three heads are present? Triceps suri is another term, just like the pes anselinus. This is the triceps suri. Three heads: soleus, फिबुला के हेड से ओरिजिनेट हुआ, पोस्टीरियर सरफेस से ओरिजिनेट हुआ, मीडियल सरफेस ऑफ द फिबुला. यहाँ पूरे से सोलियस की ओरिजिन है. दिस इज द ओरिजिन ऑफ द सोलियस. Here is the soleus. So three heads: soleus, medial head, and the lateral head of the gastrocnemius. They all converge to form a common tendon, and it is inserted into the calcaneum bone of the foot, the posterior surface of the calcaneum. This is the Achilles tendon. And that tendon is the strongest tendon in our body. Gastrocnemius is the powerful, strongest muscle, a calf muscle, and the Achilles tendon is the strongest tendon in our body. This is the Achilles tendon. So Achilles tendon or the calcaneal tendon receives insertion of the three heads, two important muscles, gastrocnemius and the soleus. Now one muscle is left in the superficial subcompartment, that is the plantaris. Plantaris is long, thin, cylinder-like, and it can be confused, mistaken in many cases during the surgical procedures by nerve. Its function is insignificant because it is very thin, cylinder-like. Because of its less functional importance, it can be used in the different reconstructive surgical procedures of the surgeries of the tendons of the hand without any disability. It can be used. So it can be used as the grafting as well. Origin of the plantaris from the inferior end of the lateral supracondylar line of the femur, posterior surface of the calcaneum. It is also inserted into the posterior surface. This is but not Achilles tendon. Okay, Achilles tendon when we have the gastrocnemius and the soleus. This is the Achilles tendon, gastrocnemius and the soleus, triceps suri. Here we have the plantaris from the inferior end of the lateral supracondylar line of the femur. This is the lateral supracondylar line, origin from the lateral inferior end of the lateral supracondylar line of the femur, and it is long, cylinder-like, thin, and then it is inserted into the posterior surface of the calcaneum. So all these superficial muscles in the posterior compartment, they get inserted into the signal bone, that is the calcaneum. Okay. Two will form the Achilles tendon and the plantaris is also inserted into the posterior surface of the calcaneum. This is again slide showing the thin cylinder-like muscle, the plantaris, origin from the lower end of the lateral supracondylar line. This is the plantaris, and then it is inserted into the calcaneum. Now look at this here in this. This is the cylinder muscle, that is the plantaris muscle. This is the soleus muscle, and soleus originates from the medial third of the medial surface of the tibia, from the head of the fibula, from the posterior surface of the fibula. This whole is the soleus muscle. And superficial to the soleus muscle, the most superficial muscle is the gastrocnemius. Then we have the soleus. Then we have a thin muscle, that is the plantaris muscle. Now the deep muscles. Deep muscles में we learned, we talked four important muscles. These are the popliteus, Tibialis posterior, Flexor hallucis longus, and the Flexor digitorum longus. Before covering the deep muscles, any confusion or any question related to the superficial group? Achilles tendon, okay, plantaris is a long tendon, or it is a long plantaris is having not a, it is a small muscle but a long cylinder tendon. No, plantaris, Achilles tendon is formed by the gastrocnemius and soleus. Plantaris is not involved in Achilles tendon, okay. Plantaris is also get inserted into the calcaneum, posterior surface of the calcaneum, but the Achilles tendon is different from the plantaris insertion. Any question related to the plantaris was shown about the soleus? Okay. Yes. This is in the initial part, it is above the soleus, but in the middle one third it crosses the soleus. This, look at this slide. The most deepest origin of the plantaris is deep. The origin of the plantaris is deepest to the soleus. सबसे पहले plantaris की origin हुई, फिर middle third में it crosses the soleus. Okay, getting my point? And the gastrocnemius is the most superficial group. So we can say that when we are discussing the relations of the plantaris, we can say we can divide the muscle into three segments: the superficial segment, the middle segment, and the deep segment. The superficial segment is the most deepest in the plantaris. Getting my point? Then the middle one third there is soleus, and it will form a bed for the plantaris to pass. Any question? Any more question? Yes, ठीक है, right? Any more questions? So, most superficial will be the gastrocnemius. Yes. Just we can say the plantaris is passing on the soleus. Okay, in the middle one third. Okay, for the first question, that is the three heads of the gastrocnemius and soleus. We will cover this from the slide. Yes, this slide, gastrocnemius, soleus. This is the Achilles tendon. This slide, yes, medial head and the lateral head of the gastrocnemius and the soleus. So that together, these three heads, soleus, medial head, and the lateral head, they will form the triceps suri. The term used for the three heads is the triceps suri, and this is the attachment of the Achilles tendon on the posterior surface of the calcaneum. Achilles tendon, or we can term it calcaneal tendon. The common term, interchangeable term, on the posterior surface. This is the Achilles tendon. Okay. Soleus, plantaris, we are done. Now the deep muscles. Number one, the popliteus. Then Popliteus muscle. This muscle will form floor of the popliteal fossa. What is this popliteal fossa? We will cover this popliteal fossa on Wednesday. That is on the posterior surface of the knee joint, just like the tibial fossa. So the floor of the popliteal fossa is formed by this muscle, the popliteus muscle, origin, lateral surface of the lateral condyle of the femur, insertion, posterior surface of the tibia, superior to the soleal line, lateral surface of the lateral condyle of the femur. This is the origin. Lateral surface of the lateral condyle of the femur. Okay. And insertion, where it gets inserted, this is lateral condyle of the femur. The posterior surface of the tibia above the soleal line. So it's a triangular shaped muscle. This lateral condyle of the femur, lateral surface, triangular band-like muscle, posterior surface of the tibia, and this muscle will form floor of the popliteal fossa. One more thing regarding the popliteal fossa and regarding the gastrocnemius muscle, sorry which I forgot. The medial and the lateral head of the gastrocnemius muscle forms the boundaries of the popliteal fossa as well. The medial and the inferior boundary of the popliteal fossa as well. Medial and the lateral head of the gastrocnemius muscle, they will form the inferior boundary of the popliteal fossa as well. And the popliteus muscle, this will form the floor of the popliteal fossa. So origin from the lateral, this is the lateral side of the lateral condyle of the femur, and insertion into the posterior surface of the tibia. This is the deep muscle, and it is deeply attached to the bones of the leg. Now, the second muscle, that is the flexor digitorum longus, of the deep subcompartment of the posterior compartment of the leg, flexor digitorum longus. This flexor digitorum longus originates from the medial part of the posterior surface of the tibia, medial part of the posterior surface of the tibia. The posterior surface is responsible to give this, and insertion to the base of the distal phalanx of the lateral four digits, flexor digitorum longus, as its name indicates, for the lateral four digits, digitorum longus, and flexor hallucis longus for the grade 2, distal phalanx of the grade 2. We will discuss later. Flexor digitorum longus. Now just have a look on this slide. Posterior surface of the tibia, medial part of the posterior surface of the tibia. Origin. This is the medial part of the posterior surface of the tibia, and then later on the four tendons for the distal phalanx of the lateral forefinger, not for the big toe. Flexor hallucis longus will divide and form the tendons for the big toe. Now the one thing which I told you regarding the retinacula, the flexor retinaculum, which is a continuation, reflection or reinforcement of the transverse intermuscular septa that is present between the superficial subcompartment and the subcompartment. Later on distally, it will form the flexor retinaculum. That retinaculum at the lower end of the foot forms separate compartments for all the tendons of the flexor digitorum longus, flexor hallucis longus, plus the artery and the nerve that is present in the posterior compartment. It will goes to the foot, to the and these flexor digitorum longus. It will form for the tendons for the lateral four digits. Again, base of the distal phalanx of the lateral four digits. Flexor digitorum longus, and it will cause plantar flexion. Plus, now the one thing regarding for the popliteus muscle. Popliteus muscle is a small muscle, and it do not cross the ankle joint. So it is not a plantar flexor of the ankle joint. It is only a flexor of the knee joint, popliteus muscle. Remaining muscles in the superficial and the deep subcompartments of the posterior compartment, they are responsible for the plantar flexion at the ankle joint, for the flexion of the toes, and the inversion at the tarsal and the subtalar joints. Okay, popliteus is this is the popliteus muscle, and it is a small muscle. It is not crossing the ankle joint. So it is not, it is present in the deep subcompartment of the posterior compartment of the leg, but this is one differentiating point. It is not responsible, this only sole muscle is not responsible for the plantar flexion at the ankle joint. जब मौजूद ही नहीं है तो कैसे एक्ट करेगा? ओके, नाउ द फ्लेक्सर hallucis longus. Flexor digitorum longus, we have done. Hallucis always stands for the big toe. The hallucis term always stands for the big toe. Origin from the inferior 2/3 of the posterior surface of the fibula. Flexor digitorum longus की origin from the posterior surface of the tibia, and that originates from the posterior surface of the fibula. Plus the interosseous membrane. What is this interosseous membrane? It is simply a fibrous tissue that binds the two bones of the that is the tibia and the fibula. Insertion, flexor digitorum longus, that is inserted into the base of the lateral 4 digits. Now the tendons, the flexor digitorum longus, and when we are talking about the flexor hallucis longus, there is a separate sheet and compartment. The retinaculum will form a protective sheet or compartment, separate compartment for all these muscles that goes into the foot, base of the distal phalanx of great toe. Just have a look on this slide for the base of the distal phalanx of the great toe. This is the flexor hallucis longus. Only for one. This is responsible for flexion of the great toe, and all these on flexor digitorum longus for all lateral 4 digits. This. Okay. Now one is left, that is the tibialis posterior. Tibialis posterior origin from the interosseous membrane, posterior surface of the tibia, inferior to the soleal line. This is the origin of the tibialis posterior and insertion into the tuberosity of the navicular bone. Bones of the foot, I am repeating again the name: talus, calcaneum, navicular, cuneiform, cuboid. These are bones of the foot. So insertion of the tibialis posterior into the calcaneum, tuberosity of the calcaneum, cuneiform, cuboid. This is the term sustentaculum tali. Don't get confused. Of the calcaneum bone. Sustentaculum tali, when you will cover the osteology of the foot, it is simply a shelf-like structure that is present on the anterior medial surface of the calcaneum. This is the calcaneum bone. For example, anterior medially there is a small shelf for a groove is present to get the attachment insertion of the tibialis posterior muscle. Sustentaculum tali of the calcaneum. Anterior medially there is a groove present. Okay, so the tibialis posterior insertion origin from the posterior surface of the tibia, inferior to the soleal line. This is the tibialis posterior, inferior to the soleal line, posterior surface of the tibia. This is the tibialis posterior, and later on into the navicular. This is the tibialis posterior. Tuberosity of the navicular, cuneiform, बहुत सारी चीजों में insertion है, and into the calcaneum also. Tuberosity of the navicular, cuneiform, tibialis posterior insertion, more than one bone. Cuneiform, cuboid, foot bones. So many bones are involved. This is a slide showing the flexor digitorum longus. Flexor, all these, and here is the retinacula will be present, which I told you. The retinacula, the attachment of retinacula will extend from medial malleolus to the calcaneum to hold these tendons, यहाँ से यहाँ तक. And from where we get these this retinacula, that is termed as flexor retinaculum. This is simply continuation lower end of the transverse intermuscular septa that is present between the superficial and the deep subcompartment of the posterior compartment of the thigh. Flexor retinaculum की two slides और हैं. This is a slide showing the flexor retinaculum from the medial malleolus to the calcaneum, and this is responsible to hold the tendons plus the nerve and the artery that is responsible to supply the posterior compartment of the leg. This is the flexor retinaculum attachment from medial malleolus of the tibia superiorly and inferiorly to the calcaneum. Now, anyone can ask you a question, the contents of the flexor retinaculum. So you can say the contents, all these are the flexor, the tendons of the deep compartment, that is the flexor hallucis longus, flexor digitorum longus. You can see in this slide also, flexor digitorum longus, flexor hallucis longus, plus the artery and the nerve of this compartment. Tibialis posterior, all these muscles here, tibialis posterior tendon. Tendons of all these muscles, then it passes under the cap of this, under the cover of this, then it goes to the foot, flexor retinaculum. This is again slide showing the superior and inferior extensor retinaculum for anterolaterally. This is for anterolaterally, and for on the medial side up to the medial malleolus and calcaneum we have the flexor retinaculum. This is the again slide showing the flexor retinaculum. Here we have the flexor retinaculum from medial malleolus to the calcaneum. These are the superior extensor retinaculum, inferior extensor retinaculum. Here is the, you can see in this slide also Achilles tendon, calcaneum. This is the flexor retinaculum. Okay. This is the flexor retinaculum, and all tibialis posterior, all the tendons, flexor digitorum longus, flexor hallucis longus, all these are passes under the cover of that flexor retinaculum. The deep compartment muscles, the deep subcompartment muscles. Okay. Now the clinical related to this ATRS, Achilles tendon rupture. Achilles tendon is most commonly ruptured tendon. Sports activities may usually ruptured Achilles tendon, and it is the strongest and thickest. A popping or sound will be produced if it will get ruptured, and the pain it produces and symptoms is very sharp. This you can see in this slide, the rupture of the Achilles tendon. Calf muscles, the prominence of the calf muscle is just because of the gastrocnemius muscle. This is the strain, or it can lead to the muscle paralysis plus the muscle necrosis, and it can lead to the paralysis. This is the Achilles tendon. Now you can see in this slide, and you can compare these two slides, the normal Achilles tendon appearance and the ruptured Achilles. This is the tendon, the muscle belly. Later on, the starting point where it expands, later on it narrows down to form the tendon. This is the normal appearance of the Achilles tendon. And if it will get ruptured, look at this appearance of the ruptured Achilles tendon. This is again ruptured, it will produce a gap. One more thing, between the Achilles tendon and the skin, there is a bursa always present, and subcalcaneal bursa. That bursa is called subcalcaneal bursa. I'm repeating again, between the calcaneum and the Achilles tendon. Calcaneum is a bone, there is always a bursa present, and that bursa will help the skin to move over the taut tendon. So this is the rupture. There is a gap will be produced, and this is because the rupture of the Achilles tendon. Fusiform swelling indicates. Now, any more question related to the topic? This is the fusiform swelling that indicates, or this also indicates the rupture of the Achilles tendon. 2-3 things left. Fibula. Fibula is simply a sesamoid bone, that is usually embedded in the lateral head of the gastrocnemius. A small sesamoid bone that is usually found get embedded in the fibula, and if it is present, it is termed as fibula. Small sesamoid bone usually identified. You can see in this fibula. It is embedded in the lateral. Occasionally, it is found, and it is present in the lateral head of the gastrocnemius muscle. Tibialis posterior tendon can also be ruptured. This is the flexor diagram. It holds the tibialis posterior tendon. Here is the tibialis anterior. This is the tibialis posterior, which is highlighted by yellow. And by different sports activities or pressure, it can lead to the rupture of the tibialis posterior tendon. Any question related to topic I highlighted this fascia by strain gastrocnemius. This is the gastrocnemius calf muscle, important muscle, powerful muscle, acting muscle, but it can, different sports activities can lead to damage. Any damage or decreased blood supply can lead to the muscle necrosis, and later on consequences of that is the paralysis of the muscle. Okay. Any more question related to the topic? Sustentaculum tali is simply the anterior groove present anterior-medially. Okay. Once you will do the osteology of the foot, you will get more knowledge regarding the sustentaculum tali. Any question related to the topic again? The muscles. Now you are able to understand the compartments, how it is divided, how the posterior compartment. Okay, I am asking question. How the posterior compartment of the leg is divided into two subcompartments. Which structure divides the compartment? Write down in your check box. What is that structure that divides the compartment? Very good. Transverse intermuscular septum. Good. That is responsible to divide the is also flexor retinaculum. Okay, good. Medial malleolus up to the calcaneum. Transverse intermuscular septum deep down there. Okay. Name the muscles of the superficial group. Superficial subcompartment muscles name of the posterior compartment of the leg. Gastrocnemius, okay, good. Zahra, soleus, and the plantaris. Very good. Gastrocnemius, soleus, and the plantaris. Now the deep group. Name the muscles deep subcompartment. Zahra, Safa. इनके अलावा भी तो और लिखे मुस्तफा. Very good. Popliteus, and will form the flexor digitorum longus, flexor hallucis longus. Very good, Bisma. Popliteus. Popliteus will form as a small muscle. What is the differentiating point? What is the one feature common to the flexor digitorum longus, flexor hallucis longus, and tibialis posterior, but not for popliteus? Good. Popliteus is not plantar flexor of the ankle joint. Getting my point? Because this is a small muscle. छोटा सा muscle है, वहीं पे originate, वहीं पे insertion खत्म होगा. So it acts only on the knee joint. Okay. Second session, I will cover the next session also, the posterior compartment of the leg, the neurovasculature of the posterior compartment of the leg. We will cover the arteries and the nerves of the posterior compartment of the leg in the afternoon. Okay. No, Ruksar, it doesn't act on the ankle joint because it do not reach up to the ankle joint. वहीं पे start हो, वहीं पे खत्म हो गया. How is it possible that it acts on the ankle joint? How will the rupture be called muscle necrosis? There is a rupture. Blood supply भी नहीं हो रही, muscle के fibers भी damage हो गए. How will they get their blood supply? Okay. Okay. I hope by repeating again and again, you are able to understand the different group of muscles that are present in the superficial subcompartment and deep subcompartment, the arrangement of the flexor retinaculum, how it holds the tendons